Hi, I'm Manny. I'm from Bay Area Chiros. This is Aaron from the SF Marathon. We're here to talk about some injury prevention, and one of the common complaints most runners have is about ITB, or Illiotibial Band Syndrome. The ITB attaches right in the front of the hip, wraps all the way down the side of the leg, attaching to the lateral knee, but also comes around right underneath the patella. But it really isn't a thin fiber as most people are used to it. It's actually really thick as it comes up right through here and opens up right into the glute max. So when we do our stretching or when we do our foam, we want to make sure we actually roll to the posterior portion to catch as much of that as we can. So right now we'll go off and we'll do the stretch. It's called, I like to refer to it as a little teapot stretch. And what we'll do is we'll assume it's her left leg that's being affected right now. So she'll take her right foot, okay, place the heel inside the arch of the left foot, and she'll begin to squat down, okay? And as she squats down, she's gonna start to push the affected hip out away from her. And she'll lean her upper body away. And what she'll do is she'll increase the stretch right through here, and she'll hold this stretch for about 10 to 15 seconds, then relax out of it, and then re-stretch it at least 2 to 3 times. How's this feel?
Kind of hurts.
Kind of hurts, but it'll work and make you feel a lot better. So from this stretch, we'll come on out, and then what we're gonna do is we're gonna go ahead and go into a foam rolling exercise to be able to foam roll this whole side of the leg, but slightly rocking back and forth to catch the fibers that actually make up the whole ITB. So I'm just gonna take 1 second to explain that if you never foam rolled before, when you lie on your side, this can be a little uncomfortable. So the way you make it a bit more comfortable is you take the unaffected leg and you place it behind you to support you. So as you start to pull yourself up and down the foam roller, you'll be pushing down into the ground to alleviate some of your body pressure. But you can take your leg and place it behind you or in front of you to be able to find what's most comfortable. Now, if you've done this before, one of the most effective ways is to place both feet together and then pull yourself up and back as needed. Erin right now is foam rolling her ITB. She's gonna go all the way to the lateral of the knee, all the way up to the hip where it attaches, and she'll slightly rock back and forth, trying to get as much as the band as possible. When she finds an area that's really tender, she's gonna use it as a trigger point and work over that area 4 or 5 times, or maybe even holding it a little bit to break up the adhesion or the tension in that muscle. But she'll do this 5-6 times. What's really good is being able to do this on a daily regimen, but if time does not allow that, you definitely want to do it before a run or after a run, or any other exercise, just to be able to keep things even. After she's done doing this, we'll transition over to go ahead and do some exercises for the glute medius muscle to be able to help benefit the ITB. So now we're gonna assume it's her right leg that's affected right here. And what she's gonna do is she's elongated. She's gonna keep both legs straight, okay? As she raises this leg up, she's gonna make sure she turns the foot in, okay, to really activate the glute medius, which helps stabilizes the hip and reduces the irritation within the ITB. And she'll do 3 sets of about 15 repetitions, lowering the leg and raising it as high as she can. Okay, really feeling the tension back there. And you do this, like I said, 15 repetitions for about 3 sets, but you always want to be even, so you should roll over to the opposite side and also do that side as well. So the combination of these 3 things will actually help reduce the amount of irritation that you have, and maybe even help stabilize and remove the chronicity of your ITB. So remember, you want to start off with the stretch. We did the teapot, you foam roll, and then you follow up with the strengthening exercise as well.